The press briefing was after an emergency regional health committee meeting held at the Upper West Regional Coordinating Council. The Regional Director of Health Services, Dr. Damien Punguyure, briefed the media on the dreaded COVID-19 virus and the recent outbreak of yellow fever in the region.
The region recorded 745 confirmed cases from March 2020 to October 2021. Of this number, 36 persons have unfortunately lost their lives. The region currently has no active case, but since life has gradually returned to normal with increased social mobility and social mixing, there's the need for the general public to step up adherence to all the public health and social measures, including frequent hand hygiene, wearing of nose or face masks, public gathering preferably in open spaces, and practicing social distancing. Vaccination has been one of the most effective public health interventions that save billions of lives. Since February this year, Ghana has introduced COVID-19 vaccines into the country in phases, beginning with some selected districts in Greater Accra, Ashanti, and Central regions. The Upper West region took delivery of its first COVID-19 vaccines in March this year, which targeted health staff and some key personalities, including census officials and enumerators, as phase 1 of the regional rollout plan. A total of 10,874 health staff and census enumerators were vaccinated in the first phase. The second phase of the exercise commenced in September and has continued to date, targeting the general public who are 18 years and above, excluding pregnant women. All districts in the region are currently administering the vaccine to the eligible population. So far, the region has received a total of 210,980 doses of 3 different types of vaccines and has administered 124,480 doses to 91,017 persons, representing 19% of the target population as of 17th November 2021. However, only 5.9% of the region's targeted population is fully vaccinated. That is, they have either received 2 doses of AstraZeneca or 1 dose of Johnson & Johnson.
According to the director, 6 people have so far lost their lives to yellow fever in the Wa East and Sisala West districts.
The region has recorded suspected yellow fever outbreak in Wa East and Sisala West districts. So far, 6 persons have lost their lives. However, there is no person on treatment as at now. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes. The yellow in the name refers to the jaundice that affects the patient's eyes. Symptoms of yellow fever include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. A small group of patients who contract the virus develop severe symptoms, and approximately half of those die within 7 to 10 days. Prevention is mainly by taking the yellow fever vaccine or preventing the bite of a mosquito. A yellow fever vaccine provides lifelong immunity to an individual. In this outbreak, the region is supporting the district teams to investigate and initiate appropriate prevention and control measures. Vaccination is currently ongoing in the affected communities. A total of 2,545 persons aged 6 months to 60 years in the affected communities have been vaccinated, representing 38% of the targeted population, which is 6,909.
Dr. Punguyure admonished residents to remain calm, but strictly adhere to the safety protocols of the 2 conditions.
Get yourself vaccinated against yellow fever if you never had one. Avoid mosquito bites by wearing clothing that cover all parts of the body. Report to the nearest health facility if you have fever, yellowish discoloration of your eyes, general malaise, headache, nausea, and vomiting.
From the Upper West Regional Coordinating Council, my name is Latif Mahama, Citi News.